The cardiac monitor went off at 5:48 in the morning, 12 minutes before dawn, and it wasn't the patient who caused the alarm. It was the forbidden kiss between Dr. Sarah Mitchell and nurse Marcus Webb, right there in the ICU at Valentim Hospital. A dangerous kiss that no one could see, but someone saw, and now everything is about to fall apart. You're going to discover in this episode how a 12-minute moment completely changed the lives of two dedicated professionals, how this forbidden kiss in the ICU put careers at risk, and why the alarm that went off that morning, minutes before dawn, revealed secrets that Valentim Hospital had been hiding for years. Stay until the end, because what happens in the final minutes will leave you anxious for the next episode. The early morning at Valentim Hospital always had something sacred about it. Those minutes before dawn, when darkness still covered Chicago and the hospital's artificial lights seemed to be the only ones in the world, brought an almost spiritual quietness. It was in this moment that Dr. Sarah Mitchell found peace. Cardiac surgeon, 34 years old, brown hair always tied in a perfect bun, she was known for her precision with the scalpel and her emotional coldness. 5 years at Valentim Hospital, and no one had ever seen her lose control. Until that morning, Sarah was in the ICU reviewing the medical records of Mr. George Hamilton, 67 years old, post-operative from cardiac surgery performed by herself 16 hours earlier. The man was stable, breathing with ventilator assistance, monitors showing vital signs within expected range. She was noting down the data when she felt his presence behind her. Marcus Webb, ICU nurse, 29 years old, the kind of man who seemed born to care for people, firm hands, soft voice, attentive gaze, and completely off-limits to Sarah. Marcus didn't say anything when he approached. He just stood there, a few inches from her, checking the monitor of the patient next to her. Sarah felt her heart race. This had been happening for 3 weeks. Her long glances during rounds, hands touching by chance when passing instruments, conversations that lasted longer than they should in the empty hallway. Nothing had happened, yet, but the tension between them was as real as the heartbeats displayed on the screens around them. There were 12 minutes until dawn when Marcus finally broke the silence. He whispered her name. Just that, Sarah, and she turned her face. Their eyes met in that ICU penumbra, illuminated only by the bluish light of the monitors. He took a step forward. She should have stepped back, should have remembered she was his hierarchical superior, should have thought about the hospital rules regarding relationships between employees of different levels, should have remembered she was married, but she did none of that. When Marcus's lips touched hers, Sarah closed her eyes and allowed it. The kiss was soft at first, almost hesitant, as if both could still go back and pretend nothing happened. But then it became more intense, urgent, charged with all those weeks of repressed desire. His hands found her waist under the white coat. Her hands rose to his face, feeling the unshaven beard from the night shift. It was exactly at this moment, in the middle of that forbidden kiss, that the alarm went off. A sharp, piercing sound, echoing through the entire ICU. Sarah and Marcus separated instantly, both their hearts racing no longer from passion, but from panic. Mr. Hamilton's monitor showed an erratic line, ventricular fibrillation. The patient's heart was going into cardiac arrest. Medical training took control. Sarah ran to the patient's bedside. Marcus was already pulling the emergency cart. She started chest compressions while shouting commands. Marcus prepared the defibrillator. Other nurses came running, awakened by the alarm. Dr. Jennifer Costa, second-year resident, appeared breathless, still tying her hair. Sarah didn't stop compressions for even a second, counting out loud, maintaining the perfect rhythm that years of practice had engraved in her muscle memory. Charge to 200 joules. Clear. Shock. Mr. Hamilton's body contracted on the gurney, all eyes on the monitor, still in fibrillation. Sarah resumed compressions. Marcus prepared the medication, 1 milligram of epinephrine. He injected it into the central venous access while Sarah continued compressions, sweat beginning to form on her forehead. Charge to 300, clear, shock. Again, the body contracted. And then, after seconds that seemed like hours, the cardiac rhythm returned. Sinus, regular. Mr. Hamilton was back. Sarah finally stopped, her hands trembling slightly from the adrenaline. She looked around. 5 nurses, 2 residents, all looking at her, waiting for instructions. And then she saw. In the back, almost hidden at the ICU door, Dr. Rebecca Stone, head of the cardiac surgery department. 52 years old, short grey hair, always serious expression. And at that moment, her narrowed eyes were fixed on Sarah and Marcus with an intensity that made Sarah's stomach turn. How long had Rebecca been there? What had she seen? Sarah tried to maintain composure, giving final instructions about the patient, adjusting medications, requesting tests. But when she looked up again, Rebecca had disappeared. Marcus had noticed too. They exchanged a quick glance, loaded with concern. They didn't need to speak. Both knew that if Rebecca had seen the kiss, serious problems were coming. Dawn finally came to Valentim Hospital. The golden sunlight began to enter through the large ICU windows, dissipating the shadows of early morning. Sarah finished stabilizing Mr. Hamilton and left the ICU with wobbly legs. She needed to process what had happened. Not just the cardiac arrest, but the kiss. That dangerous kiss 12 minutes before dawn that could cost her career, her marriage, her reputation. She went straight to the women's locker room, locked herself in one of the bathrooms, and finally allowed herself to breathe. What had she done? Sarah Mitchell, the perfect surgeon, the impeccable professional, had kissed a subordinate in the ICU. And worse, she had enjoyed it. Every second of that forbidden kiss was engraved in her memory. The softness of his lips, the way he held her as if she were precious and fragile, so different from the way her husband David touched her lately. Or rather, the way David didn't touch her anymore. Sarah and David had been married for 7 years. He was a corporate lawyer, successful, handsome, exactly the type of man her parents approved of immediately. In the first years, it had been good. Not passionate, but comfortable, safe. But in the last 2 years, something had cooled. Conversations became superficial, sex rare and mechanical. They lived like polite roommates, not like husband and wife. Sarah had tried to talk about it a few times, but David always said it was just a phase, that work was demanding, that things would get better. And then Marcus Webb had arrived at Valentim Hospital 3 months ago, transferred from a hospital in Boston. From the first day, Sarah felt something different, the way he really listened when she spoke. How his eyes lit up when they discussed complex cases, how he made her laugh with intelligent comments during the most tense rounds. Marcus wasn't trying to impress her or compete with her. He simply saw her, really saw her. And God knew how tired Sarah was of feeling invisible, but that didn't justify what she had done. Sarah left the bathroom, washed her face with cold water, and looked at her reflection in the mirror. Deep dark circles, pale skin, the normally confident brown eyes now full of uncertainty. She needed to focus. She still had a whole day ahead. 3 scheduled surgeries, rounds with the residents, administrative meeting. She couldn't afford to fall apart now. When Sarah returned to the hallway, she almost bumped into Marcus. He was leaving the men's locker room, already in regular clothes, jeans, and a navy blue shirt that enhanced his eyes. His shift had ended. They stood there, stopped, not knowing what to say. It was Marcus who spoke first, his voice low. "We need to talk about what happened." Sarah looked around quickly. The hallway was relatively empty, but still it wasn't the place. "Not here. Not now." She responded without looking in his eyes. "There's nothing to talk about. It was a mistake. It won't happen again." The pain that crossed Marcus's face was like a stab in her chest. But Sarah kept her expression firm, professional. She turned and started walking down the hallway, each step seeming to weigh tons. Marcus didn't follow her, and although it was exactly what she had asked for, Sarah felt a deep sadness realizing she might have just destroyed the only real thing she had felt in years. The day continued in a blur of surgeries and consultations. Sarah operated with her usual precision, her hands steady and confident, even when her mind was in turmoil. Between the second and third surgery, she checked her phone. 3 messages from David. The first asking if she would come home for dinner, the second saying he had a meeting and would arrive late, the third, sent 20 minutes later, saying he would actually sleep at the office because he had too much work. Sarah didn't even bother to respond. It was always like this. At 4 in the afternoon, Sarah was called to Dr. Rebecca Stone's office. Her heart raced. She knew this conversation was coming. She knocked on the door and entered when she heard Rebecca's sharp command. The room was Spartan, just a desk, chairs, diplomas on the wall, and a photo of Rebecca with her husband and 2 grown children. Rebecca was sitting behind the desk, hands interlaced, expression unreadable. "Sit down, Dr. Mitchell." Sarah sat, maintaining an upright professional posture. Rebecca studied her for a long moment before speaking. "I want to talk about this morning. Mr. Hamilton's cardiac arrest." Sarah felt momentary relief. Maybe it was just about the patient. She began to explain the clinical events, but Rebecca interrupted her with a hand gesture. "I'm not questioning your medical skills, Sarah. You saved the patient. You did everything right as soon as the alarm went off." There was a strange emphasis on the last words. As soon as the alarm went off. Sarah swallowed hard. Rebecca continued, eyes fixed on her. "But I'm concerned about what happened before the alarm. We've reached a delicate point here, Sarah. You're one of our best surgeons. You have a bright future. Don't throw it all away because of a bad decision." Sarah felt the blood freeze in her veins. Rebecca had seen. She knew about the forbidden kiss. But how much? And what was she going to do with this information? Sarah tried to keep her voice steady. "Dr. Stone, I can explain." Rebecca raised her hand again. "I don't want explanations. I just want to make sure you understand the hospital policies about relationships between employees of different hierarchical levels, especially when one of them is married. They're forbidden, Dr. Mitchell, completely forbidden." The silence that followed was heavy as lead. Sarah finally managed to speak, her voice barely above a whisper. "I understand perfectly, Dr. Stone. It won't happen again." Rebecca nodded slowly. "I hope not, because next time it won't be just a conversation. It will be a formal investigation, and that could cost you your medical license. You're dismissed." Sarah left the room with trembling legs. Rebecca hadn't explicitly said she saw the kiss, but the message was clear. She knew, and she was giving Sarah a single chance to correct course before everything collapsed. Sarah should feel grateful, relieved, but all she felt was an immense emptiness in her chest. The third surgery of the day was a triple saphenous vein graft on a 52-year-old man. Sarah worked with the absolute concentration that cardiac surgery required, each suture perfect, each movement calculated. Dr. Jennifer Costa was assisting as first assistant, her eyes wide with admiration as Sarah explained each step. Jennifer was 28 years old, brilliant and dedicated, the kind of resident Sarah had been years ago. Full of passion for medicine, not yet worn down by hospital politics and the complications of adult life. During surgery, Sarah didn't think about Marcus, didn't think about David, didn't think about Rebecca or the consequences of that morning. She just existed in the present moment, in that sacred space between a patient's open ribs, literally holding a human heart in her hands, doing the work God had called her to do. There, in the operating room, everything made sense. There, she had control. The surgery was a success. The patient went to recovery in stable condition. Sarah gave post-operative instructions and finally took off the surgical gown. It was almost 7 at night. She was exhausted, physically and emotionally drained. All she wanted was to go home, take a hot shower and sleep. But when she arrived at the parking lot and saw Marcus leaning against her car, she knew the day wasn't over yet. He had his hands in his pockets. Serious expression. Sarah stopped a few meters away, eyes searching around to see if anyone was watching. The parking lot was relatively empty at that hour. Marcus spoke first. "I know you said there's nothing to talk about, but I need to say this. What happened this morning wasn't just from my side, Sarah. We both felt it, and you can pretend it didn't happen, but that won't make the feelings go away." Sarah felt tears sting her eyes, but blinked quickly to push them away. "Marcus, please, don't make this harder than it already is. I'm married. You work under my supervision. This is wrong on so many levels." He took a step forward. "Wrong according to who? According to hospital rules? According to a marriage that clearly doesn't make you happy? Or wrong according to what you really feel?" Anger rose quickly in Sarah. "You don't know anything about my marriage. You don't know anything about me." Marcus gave a sad smile. "I know more than you think. I know you arrive at the hospital at 5:30 every morning because you don't want to be home. I know you never mention your husband in casual conversations. I know you have that distant look sometimes, like you're trapped in a life you didn't choose. And I know that when I kissed you this morning, 12 minutes before dawn, you were more present, more alive than I've ever seen you." His words hit Sarah like punches because they were true. Every damn word was true. But admitting it would mean opening a door she wasn't sure she could close later. Sarah shook her head, her voice breaking. "It doesn't matter. It can't matter. Rebecca called me today. She knows Marcus. She knows about the kiss. And she gave me a warning. If anything happens between us again, I'll lose my career. Everything I've worked for. I can't risk that." Marcus was silent for a long moment, processing the information. Then he nodded slowly. "I understand. And I won't put your career at risk. But Sarah, at some point, you're going to have to decide if you're living the life you really want, or just the life others expect from you." He turned and started walking toward his own car. Sarah stood there paralyzed, watching him go, every fiber of her being screaming to call him back. But she didn't. She just got in her own car and drove home on autopilot. The apartment Sarah shared with David was in a modern building in downtown Chicago, all glass and steel, with a view of Lake Michigan. It was beautiful, expensive, decorated by an interior designer David had hired. But it had never felt like home to Sarah. When she opened the door that night, she was greeted by the familiar silence. David wasn't there, as he had warned by message. Sarah threw her bag on the sofa and went straight to the bedroom. That's when she saw it. The perfectly made bed, as always. But there was something different, a fragrance in the air she didn't recognize, a feminine perfume. Sarah felt her stomach turn. She started searching, not knowing exactly what she was looking for. She opened drawers, checked the bathroom, and then she found it, thrown behind the laundry basket, as if someone had tried to hide it, but failed. An earring, small, golden, definitely not hers. Sarah sat on the bed holding the earring and started to laugh. Not a laugh of joy, but that hysterical laugh that comes when life becomes so absurd you don't know how to react anymore. She had felt so guilty all day about a kiss, a single forbidden kiss in the ICU, 12 minutes before dawn. And meanwhile, David was bringing another woman to their bed. How long had this been happening? Weeks, months. The tears finally came, not so much from the betrayal itself, but from the confirmation of something she had already suspected for a long time. Her marriage was dead. Maybe it always had been. She and David had built a beautiful life on the outside, perfect for Instagram photos and dinners with parents, but completely empty inside. And Sarah had wasted 7 years trying to make something work that never had a real foundation. She picked up her phone and typed a message to David. "Found the earring. I think we need to talk." But before sending, she stopped. No, not like this. Not by text message. She deleted it and just wrote, "I'll be at the hospital early tomorrow. We'll talk when you have time." She sent it and turned off the phone. She didn't want to see the response. Not yet. Sarah took a long shower, letting the hot water wash away the day's tension. When she got out, she wrapped herself in a robe and went to the kitchen to make tea. It was almost midnight. In less than 6 hours, she would be back at Valentim Hospital, starting another day of surgeries and rounds. The endless cycle. But for the first time in a long time, Sarah allowed herself to imagine what it would be like to break that cycle. What it would be like to be honest about what she really wanted. What it would be like to choose her own happiness instead of living according to everyone's expectations. The phone rang, making her jump. She looked at the screen. It was a hospital number. She answered. "Dr. Mitchell, this is Nurse Karen from the ICU. I'm sorry to bother you so late, but it's about Mr. Hamilton." Sarah felt her heart race. What happened? The nurse explained that the patient had another arrhythmia episode, less severe than the mornings, but concerning. They had stabilized him, but thought she should know. Sarah thanked her and hung up. Should she go to the hospital to check personally? No. The resident on call was competent and could handle it. But she knew she wouldn't be able to sleep now anyway. She grabbed her laptop and started reviewing the patient's data remotely, looking for something she might have missed, some explanation for the recurrent arrhythmias. She was so concentrated, she almost didn't hear the apartment door open. David came in, tie loosened, hair slightly messy. He seemed surprised to see her awake. "I thought you'd be sleeping." Sarah closed the laptop and looked at her husband as if seeing him for the first time. "We need to talk." David sighed, that tired sigh he always gave when he didn't want to deal with something. "Now, Sarah. It's almost midnight." Sarah kept her voice calm. "I found an earring that's not mine in our bed, so yes, now." David's face lost all color. He opened and closed his mouth a few times, clearly searching for the right words. Sarah almost felt sorry for him. Almost. Finally he spoke. "Sarah, I can explain." She raised her hand. "I don't want explanations, David. I just want honesty." "How long?" He hesitated, then seemed to realize that lying wouldn't help anymore. 4 months. Her name is Amanda. She works at the office. Sarah nodded slowly. "Do you love her?" The question clearly caught him by surprise. "I don't know. Maybe. It's different with her." Sarah felt a pang, but not the devastating pain she expected to feel. "And with me? What do you feel for me?" David sat on the sofa looking suddenly older. "I don't know, Sarah. Honestly, I think I haven't known for a long time. We've drifted apart. You live at the hospital. I live at the office. When was the last time we really talked about something besides bills and social commitments?" He was right, Sarah knew, but that didn't justify the betrayal. "You should have talked to me, not cheated." David ran his hands through his hair. "I know. You're right. I screwed everything up. But be honest, Sarah. Are you happy in this marriage? With this life?" The question echoed what Marcus had said earlier. And for the first time, Sarah answered honestly, "No, I'm not happy. I don't think I have been for a long time." The silence that followed was different from the usual silences between them. It wasn't uncomfortable or tense. It was almost peaceful, as if both had finally admitted a truth they had been avoiding for years. David spoke first. "What do we do now?" Sarah thought for a moment. "I think you should sleep in the guest room tonight. Tomorrow, we can start talking about next steps. Lawyers, division of assets, whatever is necessary." He nodded. "Is that what you want? A divorce?" Sarah looked around the expensive, empty apartment. She thought about the 7 years of marriage that were really just 2 good years, followed by 5 years of pretending. She thought about Marcus and that kiss 12 minutes before dawn that had made her feel more than years with David. She thought about what it would be like to start over, free and honest. "Yes, I think it is." David nodded again, got up and went to the guest room without more words. Sarah sat there, alone in the living room, and for the first time in a long time, felt something that could be hope. She didn't sleep that night. At 5 in the morning, Sarah was back at Valentim Hospital, walking through the familiar hallways toward the ICU. She needed to check on Mr. Hamilton personally. When she entered the silent unit, she was greeted by Nurse Karen, who seemed relieved to see her. "He's stable now, Dr. Mitchell, but he had another small episode about an hour ago." Sarah went straight to the patient's bedside, checking the monitors, reviewing vital signs. Something was wrong, but she couldn't identify what. That's when she felt his presence. Marcus was there, at the beginning of the morning shift, wearing the standard blue scrubs. Their eyes met across the semi-dark ICU. He didn't say anything, just came and stood beside her, looking at the patient's data. Without speaking, they started working together. Sarah ordering tests, Marcus executing the orders, a perfectly synchronized dance of two professionals who understood each other without words. It was Marcus who noticed first. Potassium levels were at the upper limit, not dangerously high, but combined with the cardiac medication could explain the arrhythmias. Sarah felt a wave of relief. How had she missed this? She was so distracted with everything else that she had almost compromised patient care. She adjusted the medications immediately, requested more frequent electrolyte monitoring, and stood there watching until she was sure Mr. Hamilton was really stable. When she finally turned, Marcus was there waiting. They walked together to the ICU break room, a tiny space with a bad coffee machine and two uncomfortable chairs. Sarah served coffee for both, and they sat in silence for a moment. It was she who spoke first. "My husband is having an affair for 4 months." Marcus just listened, showing no surprise or judgment. Sarah continued, "We talked last night. We're getting divorced." Marcus took a sip of coffee. "How are you?" Sarah thought honestly about the question. Scared, relieved, confused, all at the same time. But also, for the first time in a long time, I feel like I'm being honest with myself. He nodded. "And what about us? What happened before the alarm went off?" Sarah looked into his eyes. There can't be an us yet, Marcus. Even though I'm getting divorced, there's still the hierarchical issue at the hospital. Rebecca was clear. If anything happens, my career is at risk. Marcus leaned forward. "What if I request a transfer to another department or another hospital?" Sarah shook her head. "I won't let you sacrifice your career for me, not when we don't even really know what this is between us." It was a kiss, Marcus, a dangerous and forbidden kiss that might have just been a reaction to my life falling apart. He took her hand on the table, a gentle touch, or it could have been the beginning of something real. "But you're right, not now. You need time to process the divorce, to find yourself again. I can wait." Sarah felt tears in her eyes again. "Why are you so understanding? This would be much easier if you were a jerk." Marcus smiled, that soft smile that made her melt. "I can be a jerk if you want, complain that the coffee here is horrible, maybe kick a chair." She laughed, a genuine laugh that seemed to wash away some of the weight of the last few days. "Thank you for understanding, for waiting. If you're really going to wait." He squeezed her hand before letting go. "I will. But Sarah, don't wait too long. Life is too short to waste on rules and expectations that don't make us happy." They finished the coffee and went back to work, professional and appropriate, but with something new between them. An unspoken promise, a possible future, if Sarah had the courage to reach for it. The day continued with its usual routine, surgeries and rounds and endless paperwork, but something had fundamentally changed. Sarah was no longer just surviving, she was beginning to imagine what it would be like to really live. 3 days later, Sarah signed the separation papers. David was civilized, almost relieved. They divided assets fairly, agreed to sell the apartment. There was no drama, no fights. Just two adults recognizing they had made a mistake and trying to correct it in the most dignified way possible. Sarah temporarily moved to a small apartment near the hospital, just 1 bedroom and a living room, but it was hers. Every book on the shelf, every picture on the wall, every choice was hers, and that was liberating in a way she didn't expect. At Valentim Hospital, Sarah and Marcus maintained perfect professional distance. They worked together when necessary, always correct, always appropriate. But sometimes, in the moments before dawn, when the ICU was silent and they met in the empty hallways, they exchanged looks that said more than 1,000 words: patience, promise, possibility. Rebecca was watching, Sarah knew, but there was nothing to see. Not yet. The alarm had gone off 12 minutes before dawn that first morning, interrupting a forbidden and dangerous kiss. But maybe, Sarah thought. That alarm hadn't been an ending. Maybe it had been a beginning, an awakening, a second chance to do things right. Mr. Hamilton was discharged 2 weeks later, completely recovered. The day he left, he shook Sarah's hand and thanked her for saving his life. She smiled and said it was just her job. But as she watched him walk out of the hospital with his wife by his side, the two holding hands after 40 years of marriage, Sarah felt something that could only be described as gratitude. Gratitude for that alarm that went off, for being forced to confront the lies she was living, for having the courage, finally, to choose the truth, even if it hurt, even if it scared her, even if the future was uncertain. Because the only thing scarier than changing was remaining in the same empty life forever. And Sarah Mitchell, cardiac surgeon, had spent years fixing other people's broken hearts. Maybe it was time to fix her own. Do you think Sarah made the right choice by confronting the truth about her marriage? Leave your opinion in the comments. And what do you think is going to happen between her and Marcus now that she's getting divorced? The next episode is coming, and you won't want to miss it, because even bigger secrets from Valentim Hospital are about to be revealed. Secrets that go far beyond a forbidden kiss in the ICU. Subscribe to the channel and turn on notifications so you don't miss anything from this story.